Hi guys, Dr. Amy, and I want to talk to you guys about neck pain and different things that you guys can do at home to help alleviate some of the neck issues and neck pain. So one of the big things that we have our patients do for home care is stretching. So a lot of people have a lot of tension through their neck depending on what they do daily. But one of the stretches I want to show you is something that can isolate that upper cervical musculature called the suboccipital muscles. So that's a big one and a big reason why people get tension headaches. So if this is something that you guys have, this is a really good one to do. So I'm going to have Dr. Ross here demo it for me while I talk you guys through it. So what we do is, I don't know, Ross, if you want to kind of angle yourself a little bit, but what you do is you're going to tuck your chin back into, just like Dr. Ross is doing here. Why that's important is that's going to help isolate that upper cervical spine. If you don't tuck that chin, it's going to really focus on that lower cervical musculature. So tucking the chin, now Ross, I'm going to have you, with your hand on top of your head, I'm going to have you pull down into one side at a time while tucking your chin. Thank you. And then pulling down. So that's going to isolate this upper cervical here when he bends to the side that way. So he's going to hold that stretch for about 10 to 15 seconds and then do the other side. So this is something that you can do while sitting at work, at your desk, just to kind of alleviate some of that tension. So I would do it a couple times on each side. Then to isolate that trap and lower cervical, because a lot of people have issues through there too. The difference is you're not going to tuck your chin now, and you're going to pull down into the side to get into that lower trap and neck muscles. And like Ross is doing, you can kind of move your head around in different positions to get the different muscles activated. So that's a big one that we have our patients do at home or at work or whatever works for them. Another thing is if they have a structural issue where they've lost that curve in their neck, after they see us for a while and get that mobility back in the spine, which is super important because if it's locked up and not moving right, it's not going to work a curve back in. But eventually after treatment, we have patients go home with a cervical mold. And this is something that they, over time, progress. They lay on their back and have this in the center of their neck. And they lay on that for a certain amount of time, and we slowly increase time as we go on. But that will help longevity in working that curve back into that spine. So if you guys have any questions or comments regarding anything I talked about here, feel free to like or comment on the video and we'll get back to you as soon as we can. If this is something that you guys suffer from as neck pain and neck issues, please call the office and get evaluated by one of our doctors so we can help you with the treatment plan that is right for you. Take care, guys, and have a good one. Thank you.